Here we have a horse, we're going to look into treatment on bone Spavin, Osteoarthritis, which is a disease that comes on horses that they are getting overloaded in the hinds. Mostly it could start when they are 5, 6, 7, 8 years old, not in the young age. Those are two parallel joints that is kind of underneath the hock, and there's a really little movements in those joints. But if they start to get an arthritis, the movement will give them pain, and because the arthritis will gives inflammation and irritation in the joint. In the later stage of this disease or this problem, it will be more and more calcificated, and the joint will be totally calcified, and the pain will be gone. So why do we use the car VM or Skanlab vet here? Is just to decrease the pain situation and decrease the inflammatory process, and get the horse to feel as good as possible in waiting for this calcification process to go totally and be final. And it seems to have a really good effect on the pain relief on the horse, because those horses you have to keep in action. You have to keep them in training in one way or another to get to irritate this joint enough to get it to calcificate as quick as possible. So meaning that is after riding the horse or trotting the horse for a session, it can be beneficial to give them a Skanlab treatment after every training session. Okay, by treating the horse leg, we can still place the return electrode on the back, because it's very easy to put it there and it's out of the way when you sit working, and you're not in the way with the legs on the horse. But first, before we place it there, we have to water the coat on the fur, because to get good connection. So we wetten it, hopefully with some warm water. The horse accepts that a little bit better than the cold water. Just moisten it and wetten it enough, and after that we're gonna add some conductive cream to get the optimal connection. So we use this Skanlab cream or Tekar vet cream, because it's made for this machine and this kind of treatment. So we get the optimal electric field through the horse to be able to get the treatment going on the leg. So I add enough cream. Massage it down a little bit in the coat, and after doing that we're gonna go down to the leg and prepare the leg as well before we attach the electrode. Okay, then attaching the return electrode, we use a rubber band and put it around the body of the horse in the moist, and then we have this knot which make it easy to tighten the band to get optimal connection. And I put the knot where I'm expecting to have the return electrode, because that gives some extra pressure on the return electrode if it's underneath the knot. Just have to find the band here behind. This is almost like pulling the saddle. He was a little bit thicker than I thought, so we just have to move this, and that's the easy why we have so many holes. We can move this around a lot and use it wherever it's needed. Then we should be good. And I tighten it firm, but not like he's stopped breathing. And I can tighten it even a little bit more. And I do that after putting the return electrode underneath. Then I have put the electrode underneath the rubber band, and I also put the cable just underneath the band. Then it won't be moving around. If the horse moves around, it won't pull the electrode away or something like that. So that's a kind of security for having it underneath there and keep it staying there. Just be sure that you get it proper underneath the knot. First we have to do is of course, like where we put the ground electrode on the top, on the back, or the return electrode, we have to wetten the coat here as well before putting cream on and start the treatment. And this is a very bony area we're going to treat. So when it's a bony area you're treating with a Skanlab vet, the Tekar VM, you have to be sure that it's not getting too warm, because you don't have any soft tissue on top of the area which can transport the heating process away quick. So just following it up a little bit more careful here compared to treating the back or the hip or even the tendons in the front. Here we only focus with the treatments on is the towel on the joint area. We're not going to treat above, underneath, just treat just locally on the joint area. Here we're working with the preset settings. That is a 10 minutes treatment time and on the level 8, not on the maximum level but on level 8, because it's a rather wide area from the medial side to the lateral side we're going to treat, so we need more time to be able to work more or less the whole joint area. And you can choose by treating first on the medial side, the inside, and then treat the other half of the time on the outside. I prefer working the whole area if possible. But either way is right, nothing is wrong about doing one side at a time. And confirm with your finger, feel with the finger against the tissue that it's not getting too hot. It should be a nice slightly warming feeling but not a heating feeling. And if the horse starts getting anxious or move around a lot, then you just pinch the minus to decrease the energy level. Sometimes the horse can move around a little bit just to rebalance themselves and put the leg in another standing position like he's doing now. Now he's moving his weight around a little bit. And we just figure out if his feeling is too hot or if he's kind of just had to replace himself a little bit. We accept that. And I control it regularly with my finger because I'm working over the bony structures which won't transport the heat away as quick as soft tissue. After treatment we have to remove as much as possible of the cream and wetten the coat to don't get any cream to stick deep in underneath the fur. And after washing it off I also rub it with paper or tissue or towel just to dry up the area as good as possible.